Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Heart failure, home care, introduction. If you have been diagnosed with heart failure, you must follow your healthcare provider's orders exactly as they were given. Your treatment plan can help you feel better and should keep you out of healthcare facilities. Most importantly, your treatment plan can help you live longer. This program will help you understand the lifestyle changes you should make if you have heart failure. It includes tips for taking your medication and also contains a section on when it's important to contact your healthcare provider. Heart failure. Heart failure means that your heart is not able to pump blood to the rest of your body at a sufficient rate. When your heart isn't able to pump all of the blood it receives, the excess fluid may back up into your lungs and other parts of your body. In addition to a buildup of fluids, the lack of blood being supplied to your body may cause symptoms of heart failure, which include difficulty lying flat in bed, tiredness and shortness of breath, weight gain. In advanced stages, heart failure can lead to a persistent cough that may include mucus or blood. Medications. Your healthcare provider may prescribe a combination of medications for you to treat heart failure. It is important to take your medication every day to treat congestive heart failure. Take your medications exactly as your healthcare provider tells you. Never take more or less medication unless your healthcare provider recommends it. Missing the dose or not refilling a prescription in time to take a dose could cause serious problems. Never stop taking your medication before getting your healthcare provider's approval. If you miss a dose, do not take 2 pills at the next scheduled dosage time unless your healthcare provider tells you to do so. It is crucial to take medication as prescribed by your healthcare provider, especially with heart failure drugs. Medications sometimes cause side effects like coughing or frequent urination. If you have side effects or questions, or believe the medication is not helping you, call your healthcare provider. Here are 5 tips for remembering to take your medications. 1. Learn the name, dose, and reason for taking each medication. 2. Make a simple chart for your medications. 3. Set a regular routine for taking medications, such as at mealtime or bedtime. 4. Set an alarm or your watch to remind you when to take your medications. 5. Use a pill box to help you organize your daily medications. Heart failure patients should avoid using non-steroidal anti-inflammatory drugs. These commonly used pain reducers can cause fluid retention. Talk with your healthcare provider about appropriate alternatives.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Nutrition. Follow any dietary instructions given to you by your healthcare provider or the dietitian. Limit your sodium or salt intake. Too much salt will cause swelling and could make it harder for you to breathe. Your healthcare provider may recommend a reduced sodium diet. Talk with your healthcare provider about how much sodium is right for you. Foods that are often high in sodium include hot dogs and sausages, processed deli meats or frozen dinners. Other foods high in sodium include canned or packaged sauces, soups, and vegetables, ketchup and mustard, potato chips and pretzels. Table salt is high in sodium and should be avoided entirely. Foods that are low in sodium include fresh fruits, fresh poultry, fresh vegetables, unsalted or low-sodium versions of foods. The best way to stick to a low-sodium diet is by reading the nutrition labels on foods and only buying foods that contain low amounts of sodium. These labels include information about the amount of sodium per serving. The label also explains the amount of food in a single serving size. On a nutrition label, sodium is listed in milligrams, or mg. It is also listed as a percentage of your recommended daily intake. Foods are considered low sodium if they contain 5% of your daily value of sodium. Foods with 20% or more of your daily value are considered high in sodium. Choose products that have 5% sodium or less per serving. Look for words such as salt-free, unsalted, low sodium, or reduced sodium when comparing food items. You may need to limit how much fluid you drink. People with severe heart failure are sometimes limited to 1.5 or 2 liters of fluid per day to prevent fluid retention. A person with a 1.5 liter fluid restriction can drink about 6 8-ounce cups per day. A person with a 2 liter fluid restriction can drink about 8 8-ounce cups per day. Things that melt, like ice cream, jello, or ice, count as fluids. Weight monitoring. To monitor your weight, weigh yourself daily at the same time of day with the same amount of clothing on. If you are overweight, talk to your healthcare provider about a weight reduction plan. Whether you are overweight or not, you must contact your healthcare provider immediately if you experience weight gain of more than 3 pounds, 1.4 kilograms, over 1 to 2 days. Your weight gain could be a sign of fluid buildup. Be sure to schedule a follow-up appointment with your healthcare provider or any specialist as instructed. Heart failure patients need close follow-up and should be seen within 7 days of leaving a healthcare facility. Activity. Regular physical activity is important. Activity restrictions should be discussed with your healthcare provider before beginning any exercise program. You should follow your healthcare provider's instructions about exertion and activity. Rest often. Any time you become even a little tired or short of breath, sit down and rest. Keep your feet and legs elevated while sitting. Do not dangle them. Plan your activities to include rest periods. Take note of your breathing patterns and how well you tolerate activity. Healthy living. Do not smoke or use other tobacco products. Tobacco is probably the single most dangerous thing you can do to your health. Avoid drinking alcohol or drink it in moderation if allowed by your healthcare provider. Men are limited to 2 drinks. Women are limited to 1 drink. A drink is defined as 1 12-ounce can of beer, 1 shot of 80 proof liquor, or 1 4-ounce glass of wine. Stay away from people with colds and flu to avoid getting an infection. Make sure you are up to date on vaccinations. All patients with heart failure should receive the pneumonia vaccine regardless of age. It is important to manage the stress in your life. If needed, ask your healthcare provider about resources that are available to manage stress. Sleep well and rest every day. When to call your healthcare provider. Tell your healthcare provider anytime you notice a change in your body or your symptoms, or if you notice new symptoms. Heart-related symptoms can be categorized into 3 color-coded zones: green, yellow, and red. If you are in the green zone, you are usually not in any severe danger. You are in the green zone if you do not experience chest pain, shortness of breath, swelling, weight gain of more than 2 pounds, 1 kilogram. If you are in the yellow zone, call your healthcare provider immediately. You are in the yellow zone if you experience difficulty breathing when lying down, shortness of breath, weight gain of 3 pounds, 1.4 kilograms in 1 day, or 5 pounds, 2.3 kilograms or more in 1 week. Other warning signs that indicate you are in the yellow zone include dizziness, increased fatigue with usual activity, swelling of the feet, ankles, legs, or stomach, the feeling that something isn't right. Call your healthcare provider immediately if you experience any of these symptoms. You should also call your healthcare provider if you experience any of these yellow zone signs or symptoms: frequent dry and hacking cough, especially when lying down, waking up out of breath at night. You should also call your healthcare provider if you experience any of these yellow zone signs or symptoms: feeling tired, weak, or faint, nausea with stomach swelling, pain, and tenderness. If you are in the red zone, call 911 right away. You are in the red zone if you experience chest pain, confusion or inability to think clearly, difficulty breathing, unrelieved shortness of breath while sitting. If you experience chest pain, it is important that you go to the nearest emergency room or call 911 right away. Visit your healthcare provider regularly and keep all of your appointments. Prepare your questions and take notes. Bring a person you trust with you to help remind you of what the healthcare provider said.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Heart failure is a serious disease that affects millions of people. If not controlled, it can progress and lead to disability and sometimes death. If you have been diagnosed with heart failure, you must follow your healthcare provider's orders exactly as they were given. Your treatment plan can help you feel better and should keep you out of healthcare facilities. Most importantly, your treatment plan can help you live longer. Heart-related symptoms can be categorized into 3 color-coded zones: green, yellow, and red. If you are in the green zone, you are usually not in any immediate danger. If you are in the yellow zone, call your healthcare provider immediately. If you are in the red zone, call 911 immediately. It is important to take your medication every day to treat heart failure. Take your medications exactly as your healthcare provider tells you. Never take more or less medication unless your healthcare provider recommends it. Do not smoke or use other tobacco products. Avoid drinking alcohol or drink it in moderation, if allowed by your healthcare provider. Follow any diet instructions given to you by your healthcare provider or the dietitian. If you are overweight, talk to your healthcare provider about a weight reduction plan. Tell your healthcare provider anytime you notice a change in your body or your symptoms. Thank you for using Explain.